your greatness. Hi, and a warm welcome to each one of you who is watching Unfear Sutra, and this is the place where you need to come to connect with beautiful and wonderful souls across the world who truly want to impact and serve the world. And what better way? And today my guest is from India. So namaste to you, Dr. Soumya.
Hello.
Yes, I mean, yes, she's smiling, and yes, she's, and all her hospital goodies that she's wearing, and that's as authentic as it can get. And why we decided to do this episode is being the next month being, or why next month? We're already here, right? We're right here in March, and we are doing this as a tribute to each one of you women here and abroad. So let me tell you a little bit about Dr. Soumya. So Dr. Soumya Holla is a senior breast cancer surgeon from Bangalore in practice for the last decade. With years of experience under her wing, she has now opened a specialized boutique breast cancer center called the Holla Breast Centre. She has performed around 1,000 surgeries for breast cancer. She's an expert in screening, diagnosis, counseling, and holistic treatment. She's passionate about creating awareness amongst all members in the society to enable early diagnosis and improved cure rates. Holla Breast Centre is Karnataka's first dedicated breast cancer hospital. Situated in the heart of the capital city, Bangalore, it offers services in the fields on surgery, medical, and Gynaec oncology. Headed by the director, our beautiful Dr. Soumya, who's on screen with us. It also starting from screening, the team follows a thorough diagnostic and treatment approach to all patients coming to the clinic. The team consists of surgeons, medical and radiation oncologists, counselors and therapists, and rehabilitation and pain management experts. All in all, it's going to be a complete holistic care. That is what we're talking about here. So welcome, Dr. Soumya Holla, to this podcast. It's also going to be telecast on our YouTube channel called Unfear Sutra. So thank you so much for making women's wellness all across the world such a priority. And it's been wonderful always having you, and welcome again. So my first question to you, Dr. Soumya, is can you tell our viewers and listeners a little bit about yourself? Because the human side of any doctor is such a mystery to each one of us. So your background, your family, and what exactly made you walk the path of becoming a doctor when you had so many options around you? So over to you, Dr. Soumya.
Thank you for calling me today. It's always a pleasure talking to Anu here. It's actually very difficult for me to look serious when I'm around you. So, what I've realized is that I come from a very middle class background, and my family is basically hoteliers and agriculturists. So the next gen, obviously, everybody picked engineering, and I hated engineering. I feel that we should all do something where we can give back to society. I have moved from an optimistic doctor to a realistic doctor. I have realized that the major people I can help is who are going through disease themselves. And me being a woman, it made a difference to me that there were no women for breast cancers patients. A lot of surgeons, very good surgeons, but they were men nevertheless. And I've realized that being human and being a woman adds to their comfort levels. The fact that I can also do surgeries and I can decide protocols for them, and they can discuss their smallest doubts without being ashamed or embarrassed about it. Thereby, I can treat them not just for the disease, but I can treat the patient, even add to the emotional approach to it, give the family clarity as to what is happening and what they have to look forward to. I think women do it better than men when it comes to family matters, because I've realized that breast cancer is not something that affects a woman, it affects families in general. So that's why it's been a long journey, but I think when I look back, I wouldn't have chosen anything else.
We are happy to have such a wonderful, and let me tell each one of you, the number of times I've interacted with Dr. Soumya Holla, she is so positive. I mean, she just, it just radiates positivity. And what else can we ask for in a doctor, right? You don't want somebody so serious and then, talking about it, and then you feel like, oh my God, is this treatment ever going to work? So she's so beautiful as a human being. Dr. Soumya, it's so right. As we were talking about, it's not about just impacting just the person. It's not just the patient, but the entire family as well. So that's something as a point, I think, our viewers and listeners, wherever you are across the world, you join in on Unfear Sutra. And this is the place where you can make a difference by not just being a guest, but listening into us, simply because each expert comes and moves you to take massive action. That's what we're here all about. So, Dr. Sami, I wanted to ask you, if you see in India, the scene in India is something that, I guess all our Indian viewers and listeners would definitely want to know. Breast cancer awareness has gained a lot of momentum in a decade or so. We're hearing more about it, maybe because we are also connected well with the internet. There's so much information floating around, the net. But I want to know from you, what is the current scene in India? I mean, you can definitely throw out statistics because we'd really like to know. It's not something, if you talk to women, they'll say, oh, breast cancer, oh, that is, somewhere there. It's about something happening to somebody else. So realistically, if you were to give us a picture, what is the scene, in India currently? What is
When women cancers came into light, it was cervical cancer, which was the leader when we started. But for the
it?
last 10, 15 years, breast cancer has shot past cervical cancer, that it is the number one cancer incidence in India right now. And earlier, when it was diagnosed, most of the patients came to us in advanced stages, probably because of no awareness. So it was also the number one killer among cancers in women. But thanks to awareness now, women are coming early. They may not know everything about breast cancer, but they know for sure that if there is a lump in the breast, she needs to get it checked. More than anything, she needs somebody to tell her that it is not a cancer, if it is not. So the awareness is so high that people are coming to us in very early stages. The
Hmm.
pattern here is very similar to the US right now, wherein women are coming forward to show themselves with very small tumors and not advanced diseases at all. Basically, pointing out that more than half the breast cancers we see right now are curable cancers now, which again increases the kind of positive mindset that patients are looking at. They're not going to come to me anymore saying, okay, that's it, write my death sentence. They are more looking with hope and optimism. And when I tell them, yes, you've come very early, this disease can be cured. This is going to become a bad memory, if not anything else. And we are looking at giving them a disease free life after treatment. It is something definitely to look forward to. Awareness has increased. Yes, it is very good. It is not something that we know that somebody has got it. Cancer is sitting on everybody's doorstep today. Everybody knows that if there is a lump in the breast, it most likely may not be normal. So it's always better to get an expert to tell them. Yes, internet awareness is there, which probably adds more anxiety than clarity. A lot of confusion because everybody adds their view on breast cancer to the internet. But it makes a difference that patients are no more in the uh, dark. There is only the fear of the unknown, but it's not that they don't even know what it is. They want to come and see that it is definitely not breast cancer, and if it is, they want to be cured for life.
Wonderful, wonderful. And picking off from what you said, Dr. Soumya Holla, is a lot of information is floating on the internet. I mean, you don't even know what to believe, right, and what you shouldn't. And then to top it all, WhatsApp. There is so much going on. We absolutely, as a woman, we don't even know. There is sometimes we hear that okay, self exams. You can do that yourself every month. Now, if as an expert in this field, if you were to actually advise a woman, from a woman to another woman, what should she do to take care of herself? Is it a breast self exam, is enough? Or should she actually go for breast scans? When should she go for mammograms? Because I do have a lot of women coming and asking me, I thought mammograms are only if there is a history running in the family, otherwise I don't have to do it. So people are still going by a lot of hearsay. So if you were to address a woman to a woman, an expert to another woman, what will you actually be advising us?
So, hereditary breast cancers form a very small population of breast cancers in India. Just because there is one close family relative with breast cancer in the family does not mean that every daughter or sister of that victim is going to get breast cancer for sure. The risk is actually only 5 to 10%. What I tell women is mammogram should be done after menopause. Ultrasounds have to be done before menopause. Having said that, ultrasounds and mammograms are advised only once a year as part of a screening health check. Now, once a year is a 12-month window. If we are lucky, the minimum interval is 12 months. So, the best thing to get a breast cancer in its early stage is to do a self breast examination every month. For a woman who's getting her periods, if today is the start of her cycle, today is day one, according to us, of the menstrual cycle, of the period cycle. So it is best to check yourself between day 5 and day 10 of that cycle. That's when retention of water is the least in the breast, and any lump will be uh, palpable or will be felt by a patient. In between two cycles, if the lump has increased in size, especially if it is painless, now the painful varieties are actually the safe varieties. It is the painless varieties that are dangerous. So if she feels that between two periods, the painless lump has increased in size, then yes, she would need first a clinical examination by an expert, which will lead to either a biopsy or a scan if required. For women who've had menopause, they don't have a regular day of the cycle to get them to do a self-examination. So what I tell them is that you pick a day, the first of every month or the first Sunday of every month. You check yourself on that day. Now, the only thing amazing about Google are the pictures for self-breast examination. It is given in detail and it can be picked up. It's very easy to replicate those pictures while doing a self-examination, and get scanned once a year as part of a screening health check, as part of your regular health check, and then take it forward if something gets picked up in that.
Okay, so that's very informative, especially for those who look at the internet and get so intimidated, like, I don't want to do it, right? It's more, a stage of denial or a scare that we're all going through. So, is there, I mean, a lot of women, especially, in my coaching field, when they'll come and ask, why me? This question is always there, why me? I have taken care of everything, I eat right. I've switched over to millets. I don't use the microwave anymore, for whatever reasons that they have understood. So do you notice, Dr. Soumya, that there's a particular strata of society or a particular age group of women that are usually, are showing these symptoms of breast cancer, or it's just very random? Are you able to pattern this entire thing?
We were like 10 years ago, in the decade before now, most of our patients were postmenopausal, 55, 60 plus. They used to do well. Now, about 70% of my patients are between 30 and 40. And in that, it is the numbers are more between 30 to 35 years of age. We don't know the exact reason why the incidence has fallen down, the age incidence has come down. But we have realized that the risk factors can be divided into modifiable risk factors and non-modifiable risk factors. The ones that you were telling, when the patient says, I eat right, I exercise daily, I don't eat red meat. But there are lots of non-modifiable risk factors. Living in a metro itself is a risk factor because the air you breathe, the water you drink, there are so many of them which are not changeable. There is nothing you can do about it, including the milk that you drink. So there's only so much that you can do. But if living in a metro itself increases your risk of getting breast cancer, you have two choices. Either hope and pray that you're not in the risk group, or move out of a metro.
So those of you, if you don't want to be under the risk category, move out of the metro. Okay. I'm just wondering, I'm just looking, okay, where's the next beach that we can all move out to?
At
Everything
least
is
we'll stop complaining about the traffic and infrastructure in Bangalore.
Yeah, you're so right. No, the thing is, I mean, it's so easy to look at what is not happening. Of course, yes, some of us may be able to move out of the metros, but well, there are some of us, our livelihood stays here. So there is that thing. This is like I like it, the awareness of start to become more mindful of your own body and what exactly is happening to it. And these are good things like keeping a calendar, marking it, and saying, okay, the first of every month, and what a postmenopausal women can do. But it is alarming when you say that, it has begun to manifest itself even in younger women is quite a scare. Possibly it's a lifestyle. I want to know, especially Holla Breast Center, you're talking about holistic care, right? So obviously you do when you're counseling a patient or when you're actually talking to them, how much you see the incidence of stress really causing cancers? Because these are questions that I get, you know, does stress directly lead to cancer, or is it one of the factors that may put me into the high risk zone? So what is your take on that? I mean, have you seen any instances where stress or chronic stress can lead to does it make them more susceptible to breast cancer?
I think 100% of patients I have seen with breast cancer are the high stress individuals. Women who tend to take on a lot more than they can handle, women who are constantly stressed about their surroundings, women who are stressed about doing the best for their family. A lot of these women actually end up not taking care of themselves. And the stress could be manifested tenfold after they've realized that they have cancer or when they realize they have a lump. But what I have seen, I don't have statistics or papers to prove it, but we know for sure that stress is a huge risk factor for breast cancer. There are very few women who say, I'm not stressed about anything, but I don't know why I got it. 100% of them generally are the type A personalities. They have been struggling to take care of the family, their jobs. They want to be the best at what they do. And they tend to worry a lot. It is generally the same strata of society. As women, I think we tend to worry more about everything around us. But breast cancer, I think, is yes, 100%. I think all the women I have with breast cancer are severely stressed.
Oh, wow. So, which means, I mean, when you're running your awareness programs, or when you're probably even talking to a woman who comes regularly for a checkup, do you specifically also, you and your team of experts that, you're connected with in your center, do you actually do any kind of holistic programs for them that can help people? Because stress, like we said, stress is never avoided, right? It's all around us. It's just how we respond to that stress. So, do you in particular take that step and actually tell them how they can manage their stress levels?
So, as a woman, I think it's easy for me to connect with them and tell them, break it down, break the areas of stress, and try to tell that woman as to these things can be done or modified or avoided completely if it is adding to your stress levels. In addition, we have counselors who can talk to a patient. Again, because I know about the disease and the treatment, it's easier for me to counsel them. But what I've realized is that they need somebody to talk to, they need to cry to somebody because they don't want to look weak in front of their family. So it's easier for them to do it in front of somebody else. In addition to it, we have yoga and meditation experts who are actually specialized in the therapy for cancers. They make a huge difference to patients who are undergoing chemo or are about to start chemotherapy. And they do counsel them just before the session on that day. And we have seen patients are better off after these counseling sessions.
Wonderful. Wonderful. So it's about also taking care of oneself. And I liked even in the previous question you mentioned about, I think as women, we somehow tend to forget that we exist. That amount of self-care, the attention that we can give to ourselves is, it's like, okay, let me finish taking care of everybody. And then, if I have time, okay, let me then start looking at myself. And I think a lot of women even pride themselves in multitasking. That increases stress. I want to do this, I can do that, I can do that. And honestly, I have felt, Dr. Soumya Holla, that I don't think it's anything to be proud of. It is very
No.
stressful. And I've honestly, to those of you who are watching and listening, I have seriously stopped. I used to pride myself. Hey, I can do this, I can do that, I can do that. Now I don't. This is all I can do. I can't do anything beyond. And it's okay to actually say no to someone, and it is okay to draw those boundaries and literally keep things that you can't do away. It is perfectly okay. If someone is going to think and mistake you, it's okay. It's all, at the end of the day, it's about yourself. My next question to you is, how can families, obviously when somebody is diagnosed with cancer, the first thing is the members start to, the family members, there's a scare, there's a palpable tension in the environment at home, right? So whether she's going through chemo or, any sort of treatment that she's going through, when she goes back home, right, you want the treatment obviously to work, right? So how can family members support the patient? So what is it that they can do so that the treatment is even better? It can really start to work.
First things first, at the time of diagnosis and treatment planning, the family members who are going to be in close contact with the patient should come. It is not about counseling for the individual alone, it is also counseling for the family as to how can you help this woman get past what she's about to go through. Second, what I've realized is that they should be, I always advise the relatives not to treat her like an invalid. Treat her as a human being. Give her the support she requires. Don't overdo it and allow her to do the things that she still can physically without straining herself. She wants to cook. She loves to cook. Allow her to cook. She wants to sleep for 2 hours more that day. Don't panic because you've never seen her sleep in the afternoon. It's okay for her because maybe this is the only time that she's ever taken a break in the afternoon. Don't treat a person who's undergoing treatment like an invalid. Then don't treat it as a stigma. Don't try to ostracize her from the other family members, from her friends, from going to a public event, from going to a wedding, because the social life that we have is very important to us. We cannot be hidden, isolated from the entire world, sitting in a room undergoing therapy. We have seen how it takes on people during the COVID crisis. That's what we saw. Isolation made people lose their minds. So we have started taking that as a parameter and saying, see what happened during COVID. Don't do that to this patient with cancer. As a family, you need to work together to help this woman tide over this crisis rather than treating her differently than before. Don't treat her differently.
So beautiful. Even as you say it, it's about everyone coming together for helping her tide over the crisis. So those of you watching this Unfear Sutra, you're here with Dr. Soumya Holla, an expert, a breast cancer surgeon, all the way from Bangalore, India. So my next question to you, Dr. Soumya Holla, is. It's about, we are trying to unfear literally the C word. It's been a scare. It's been around for decades, and the minute it is given as a diagnosis, people are just lost. I mean, it's like your world comes, tumbling down, right? So if you were to give, and you've seen multiple women, you've watched their reactions, their responses. If you were to give a positive spin-off to this entire thing, if you were to look at another woman who's sitting right in front of you, what would you tell her? Saying, okay, now that there is this, okay, how do we proceed? How do you look at it positively? Because I know, and we all know about it. Becoming positive is the first step to actually the treatment beginning, right? So, what would you tell them without, saying, "Oh my God, you need to say," I've seen a lot of doctors doing that. Don't do this, don't do this, don't do this. The list of don'ts are many. But what can she do? What should she do? If you were to give a positive spin off to unfear the C word, the cancer word, what would it be, Dr. Soumya?
Cancer is a reality to the humankind right now. It is possible that any woman, irrespective of her age, can get cancer. But if you are diagnosed with cancer, one, you should remember that this too shall pass. It is something that is not impossible, but maybe difficult, but still not impossible to go through. You have to understand that it is not the end of the road, and there is a huge bright light shining at the end of the tunnel where you will be told that it is cured. So we are working towards that. And the journey may be difficult, but the eventual destination is going to be very sweet when you know the treatment is done, and probably never look back again and live in fear that this cancer may come back. Don't live in fear. Second, you are not alone. There are a lot of patients who have undergone the same treatment as you. They're all together. There are a lot of associations. There are all lots of help groups that are available, which involve only ex patients, let us put it that way, or survivors as the world knows them. Now, these women have undergone what you have undergone, what you're about to do. So, they are the best people to tell you what to expect. And three, always cross the bridge when you come to it. Don't think of what may happen during chemotherapy. Take one day at a time. Don't try to plan your life for the next 6 to 8 months. It is going to be okay. And you have your doctors, you have your family, you have other people, even strangers who are willing to step up and help you. More than anything, the entire power is in the mind. If your mind is strong and you decide that what has happened, now I have to take it head on, it is very easy for you to go through treatment.
Wonderful. It's such a positive take on the entire thing. I'd like to know your center, you're the breast cancer center, Holla Breast Centre. So, what can we look forward to? Are there any, state of the art treatments that are going to be coming? Are you going to step more into the awareness zone like you've already been doing? So, what is it that your center is actually going to do more for women than it's already been doing? So, those of you, please look up. It's a wonderful place, and Dr. Smiling, yes, yes.
Well, we've recently expanded to we've expanded to another floor now. We have better OTs than before. I had a good OT. I have much better OTs now, which is state of the art, which is why we can do a lot of cancer surgeries as daycare surgeries. These are not surgeries that they require day to week stay in the hospital. Recovery after these surgeries is actually one day after cancer surgeries, unlike what people think. So if I do the surgeries today, by tomorrow morning she's up, she's cooking, she's cleaning, she's walking, she can do everything she wants. There is no need for bed rest after these surgeries. There is no need for diet restriction or activity restriction after these surgeries, which I think is a huge deal, because if the patient can go back to her normal life the day after surgery, her recovery is going to be super fast. So most of the surgeries that I do here are daycare surgeries. I give a lot of importance to post-op rehabilitation, which is immediate rehabilitation, not waiting for 10 to 15 days to start it. We start physio on the same day evening. We tell them what to do, what exercises they're allowed to do, how to go about it, how to manage pain without being too dependent on others. And I think my patients are very happy about going home on the same day, because I think their home is their comfort zone. You send them home on the same day, they recover faster. They're very happy instead of a hospital.
I'm sure they're happy because I mean you have such a positive doctor sitting smiling all the time. I think that's a bigger medicine than any other operation could do that. Any surgery could do that. So that's really wonderful. And I especially to sum up the discussion, the interview that we've been having. It's nice. I like what you specifically said. This too shall pass. Yeah, it's just it could just be a bad memory. It's just something that you've overcome, and any situation when we overcome a challenge, it only makes you stronger. It's like what doesn't kill you only makes you stronger, right? Secondly, what you said is you're not alone. There's so many, yes, there are so many breast cancer survivors, and they're always willing to step in and narrate these experiences, not to frighten you, but to say, hey, you know what, this is something that I know what it is to deal with it, so I'm going to step in. And I know for a lot of NGOs and people, mental health experts, there are a lot of people who are stepping in because they understand especially because you said it is a reality. It is knocking at people's doors. It is more than ever before, right? A decade and a half before, it happened to somebody else. It was something else. It was something that is there. So it's very beautiful how you put things into perspective. It is about unfearing, literally the C word. There is no necessity to fear because fear is causing you stress. Stress is again leading you to more and more health complications. And as Dr. Soumya Holla said, no, there are doctors, there are experts. So it is about crossing the bridge when it comes. Take one day at a time. That is what it is. And yes, this too shall pass. That's her favorite phrase. I know that.
It's yours too.
Yes, because it's that moment. And as we know, there is no permanence with anything, right? It's the same thing with that. So let's understand it is a situation. And the more we become an observer, and you have people like your doctors, your health experts who are all the time there, family, friends who are willing to step in. You are not alone. But at the same time, let's not ignore this. And as a part of this beautiful International Women's Month. It's not just a day. Every day should be Women's Day because we are the nucleus of wherever we are, whether it's your support group, your family, your office, anything, we are the nucleus. Let's start taking that massive action. We're not pretending that something doesn't exist. Let's understand it's a reality. Let's take charge right now. So this is Unfear Sutra, our next episode with the beautiful, ever smiling Dr. Soumya Holla talking about breast cancer awareness. How can we take charge, take massive action? Thank you so much, Dr. Soumya Holla. You
Thank
are
you. Thank you for
absolutely
having
wonderful.
me. No, it's amazing how you decide to tolerate me every few months. Like,
Actually, you know
okay,
what? We just love you. We just love you
it's the
because
same. The feeling is mutual.
what you put across in such a positive spin. It's not about. Every woman will identify saying yes. What doctor says makes sense. It is not about running away from it, and that's why we keep coming back to you to know and learn more. And so authentic, so positive, and so smiling. So those of you are watching, please watch this because you can see the smile on our face. You can watch that and feel good. And for those of you who are listening to it, so it's on Spotify and YouTube here on YouTube. Thank you so much for
Thank
joining
you.
in.
It's
We
wonderful being
love
here.
you. We love you. We love
See
you.
you soon.
Your greatness.